Hello. Thank you for joining us today to discuss how public policy can drive intergenerational solutions to community challenges. I'm Jaya Lent. I'm the Deputy Executive Director at Generations United, and I'm standing in today for our Executive Director, Kristen Kiefer, who sends her regrets that she can't join us today because of a family emergency. We are thinking of you, Kristen. I'm honored to be with you and want to extend a special thank you to the Eisner Foundation for their generous support that makes this webinar possible. At Generations United, we focus on how intergenerational connections can address and prevent some of the nation's most pressing problems. We believe in prevention through connection. So whether it's the epidemic of social isolation facing our children and older adults, or the healthcare workforce shortage, or the lack of quality, affordable childcare, we believe there is an intergenerational solution that is centered in connections. Intergenerational shared site programs are creative solutions that are ready to meet these challenges. Shared sites bring together children, youth, and older adults at the same location to participate in programs and services at the same time. In these, participants connect through both planned intergenerational activities, but also informal, everyday interactions. So to set the context a bit for today, we're going to kick off with a short video about one such program.
Studies show that intergenerational relationships are mutually beneficial. Young people gain self-esteem and have better attitudes about older adults, and interacting with young people boosts the mental and physical health of their older counterparts.
Okay, my friends, these are the preschoolers coming in, so they've got a lot of energy.
One case study is the Benavia Community Center for Older Adults in Arizona's West Valley, where many members are in the early stages of dementia. One of its biggest draws is an on-site preschool. Activities with Benavia's grandmas and grandpas are built into the curriculum.
Oh, you
When we get to see the little ones, it's very heartening. It makes us all feel younger again.
Benavia member Colleen Peterson has family nearby, but loves interacting with the younger generations here.
I had one little boy, and he was just sobbing and sobbing, and I just kind of patted him, and then pretty soon he just slid right off my lap, went with the other kids and started playing.
Peterson has mild cognitive impairment, which led to depression and anxiety. Her daughter Kathy says the children are a powerful antidote.
I think the best treatment is, socializing, and working with those kids is so cheerful. And I think that has really helped.
An added bonus, the kids benefit from these intergenerational interactions too. Alina Smallman's 3-year-old daughter Luna attends Benavia's preschool.
She's had so much fun in a couple of the different activities that they do that she'll just tell me about it for days, or she'll ask me when she gets to go and see them again.
Do you like being with the grandmas and grandpas? Do you have favorite grandmas and grandpas?
Luna didn't want to hurt anyone's feelings, so she didn't name names.
So programs like Benavia demonstrate compelling outcomes and broad support, but we see that policy barriers and startup costs routinely prevent their creation and their replication or their expansion across the country. So today we're going to explore the potential for public policy to take impactful programs like these to scale. One example at the federal level is the Care Across Generations Act. And this bill was introduced by Representatives Marilyn Strickland and Brian Steele. And the legislation would create a grant program for older adult long-term care organizations to establish on-site childcare programs, or to coordinate multi-generational activities, or expand their facilities for these purposes. So the goal of the bill really are to address community solutions, to address address community challenges, those twin childcare and adult care workforce shortages, to also impact the epidemic of loneliness among older and younger people, and also to foster empathy and understanding across generations. So this bill was introduced in 2025, and it's awaiting action in the U.S. House Education and Workforce Committee. But in addition to this federal bill, there are a host of state and local policies across the country. And today we will hear from advocates about a successful state policy in Nebraska and a multi-level strategy to support a program in Oregon. These are just a snapshot of the possibilities. Generations United is also releasing a brief today that provides an overview of these and other sample state and local policies across the country. So we invite you to review and share the resource that's on your screen. But we also ask you to join us in taking action to urge more supportive policies. And you can do this and learn more about how to do this by signing up for our policy alerts at gu.org. So as we move through our time together today, you are welcome to drop questions in the Q&A that is at the bottom of your screen. You can also continue to chat with us in the chat. We expect the panelists will respond to many of your questions during the program, but also Chelsea Rhodes, our public policy and advocacy specialist, is on hand and active in the chat and the Q&A to respond as well. So now we're going to turn over to our state policy panel, and I invite our guests to join me on the screen. So I'm delighted to introduce our panel. First is Mitchell Clark. Mitch is a policy advisor with First 5 Nebraska, which is focused on advancing early childhood care and learning opportunities through policy change, strategic partnerships, and public education across the state. Welcome, Mitch. Next, we have Cindy Cadavy, who is the Senior Vice President of Policy for Nebraska Healthcare Association, which serves and advocates on behalf of nursing homes and assisted living communities across Nebraska. And finally, Tammy Scheil, who is the administrator at Fairview Manor and Country Reflections Assisted Living in Fairmount, Nebraska, which is home to Tiny Images Child Care Center. Love that name. Welcome to our panelists. Hello. So Mitch, I'm going to start with you and wanted to just check in. So In Nebraska, we have this exciting legislation, now law, to create an intergenerational care facility incentive program. So can you just start by telling us what does that program do and what sparked the idea for the bill to create it?
Sure. Thank you, Jaya. That can be quite a wordy one, but there's a program in Nebraska, as Jaya's mentioned, the Intergenerational Care Facility Incentive Grant Program. This is a program which provides one-time startup expenditures for assisted living facilities and nursing facilities in Nebraska to utilize the grant funds to start a co-located program that would include childcare. The idea is to provide on-site programming for both elder care and childcare programming and services. The bill was initially seeded way back in 2020. So a former state senator in Nebraska, Senator Anna Wishart, who really has a passion for elder care services and is very involved in a local nursing home program, had heard about intergenerational care and had an idea and a vision for creating and supporting intergenerational programming in Nebraska. So it was really driven by her. This was not something that was very common in Nebraska. And so she introduced legislation to provide $50,000 startup costs for intergenerational programs. Due to the pandemic, however, that bill was sidetracked. There were other urgent issues that the state legislature in Nebraska needed to address. So it took a couple years yet before the bill was reintroduced. So in 2024, the bill was reintroduced as LB 1178, creating the program. They did expand the startup costs allowed, so up to 100,000, realizing that these really are capital intensive projects. Initially, the idea when it was explored was to have ongoing operational costs, but due to some fiscal constraints in Nebraska, it was limited to just the capital startup costs. So that was ultimately passed in 2024, creating the program. And I will stop there. I don't know if there's any perhaps follow-up questions as we continue to address this program in Nebraska.
Thank you. It's a helpful sort of picture of what the program does, and that it takes some time, right, to get to the place where there was a bill, and then there was a setback, or, a pandemic, and then it came and it adjusted a little bit. So this is a process, is what I'm hearing. We'll have more for you, Mitch, but I'm gonna turn it to Cindy and just the Nebraska Healthcare Association. Cindy was strongly involved in this effort. Could you tell us a bit more about how you became involved and what motivated you to partner on advocating for this legislation?
Great question. So, just kind of piggybacking on what Mitch said, Senator Wishart, a young senator, was really the champion for this legislation. So she was already working with First Five from the childcare angle, and then pulled us in because we represent nursing homes and assisted living communities across the state. So we were glad to partner on this. We had some existing childcare operations, but as Mitch said, there weren't a lot. So offering an incentive to inspire others to go in this direction was really exciting for us. And to be honest, she's a very intelligent, passionate young woman, and she just kind of swept us up in her enthusiasm for connecting the elders that we serve with the younger adults or young children that are served in the childcare.
Awesome. So the senator really connected you two as advocacy organizations rather than you all reaching out initially to each other. She connected you two. That's great. Okay, wonderful. I'm going to turn next to Tammy. So you operate a program that could ultimately, potentially, benefit from this law. Can you tell us a bit about your program first, and then why resources from this Intergenerational Care Facility Incentive Program could be helpful to you?
Absolutely. So we've ran a childcare center in our on our campus since 2002. So almost 25 years now, we have had a center. And I think in the beginning, we really, I think the first part of it was we lived in a community that was definitely underserved for having childcare services. And we're a small community of about, 500 people. And so we were looking at a way not only to benefit our employees who were really having struggles finding childcare, but also the people who lived in our community. And so it was a win-win for us to build the center. And what we have found over the years is there are so many benefits when you have an intergenerational program, not only for the children that are in it, but also for the older people. What we find is that, and I think it's in any setting, not just even older people living at home. A lot of times they're lonely, and the children really do create. Companionship for them, and they truly lessen that loneliness that these people feel. Some of the other things is I hate to say it, but sometimes in long-term care, assisted livings, nursing homes, our environment can be a little stagnant. And when children are involved in that, it creates a totally different environment that is vibrant and joyful and just it's so hard to imagine it unless you're actually involved in that. And the last thing we talk about a lot is that we have individuals who love to give care, provide care to people, and it's an innate humane human need that we all have. And so that's another thing that the kids provide for the people who live here. I mean, they don't do the exact direct care, but they still have the ability to give them guidance and purpose and meaning. And I tell a lot of people, they're like, I can't imagine running a nursing home anymore that does not have children in it on a daily basis.
I love that. I love that. And so it's been operating for some time. Now
Mhm.
this opportunity with the legislation is available, and there may be some dollars through this incentive program. Why would that be important to you? You've been
Well,
operating for a long time. Why is it important to
we've
you and
been
other
talking for a
programs?
long time about wanting to expand.
Okay.
Right now, we probably have a waiting list that I don't think we can take another child till like 2027.
Wow.
And so we've been looking for opportunities to expand the center. And so this grant process would actually give us the opportunity to expand and to be able to provide services to more people within our community and the surrounding area.
Great. Great. And I understand, Mitch, I think you mentioned at the beginning, there weren't a lot of programs like this in Nebraska. So is part of the intent to be not only expanding, but also potentially forming new programs?
Yeah, absolutely. Part of the vision that Senator Wishart had was to see more programs across Nebraska implement some shared programming because of the benefit that there are for those individuals who are served in elder care services, the cognitive, emotional benefits that they have, and also developmental experiences for children when you have a diverse array of experiences they may not otherwise have access to. So there are lots of benefits, and we want to see more of that across Nebraska.
Great. And building on that question a bit, Cindy, do you have a sense of why more programs don't just do it already? Like, why is an incentive needed? Why don't we see more of that already across the state?
So that's a great question. And when the bill was initially implemented, there was interest. But if so, nursing homes, just a little bit of background, nursing homes in Nebraska have more than 60% of their residents rely on Medicaid for the paying for their care. And that Medicaid rate really doesn't cover the cost of care. Plus, there are a lot of regulations that they need to be on top of. So, taking on the operation of a child care on top of that with its own separate regulations and reimbursement challenges just was really kind of a hurdle. Everyone agreed. There was a lot of interest. Everyone loves the idea, loves the concept. It was just getting past that initial hurdle. So we did allow, and this was in the legislation itself, so it did allow for a nursing home in one scenario to lease space for an external childcare operation. So it still provided for that intergenerational interaction and play and communication and all those great benefits, but it didn't require the nursing home to also operate a child care center at the same time. So we do have a model like that in Nebraska, at least one, that's continuing to operate. So there's really two different models. Tammy's the one where she runs both, and she's made it work over time, but we do have that other model as well.
That's great. There's many ways to do this, yet it is a challenge to just do it out of the gate. So this legislation helps to give that nudge and then incentive for programs to do something that they may want to do, but it's hard, right? From the budget perspective among staffing and other things. So thank you. Well, let's get back a bit more to thinking about how this advocacy was done. So, Mitch, what did you find most valuable in this advocacy collaboration once the senator connected you? Like, what was valuable and what made it unique, perhaps, from other advocacy?
I think what's most unique about this collaboration that we've had with the Nebraska Healthcare Association is advocacy group that we don't normally work with. Our different policy areas can be very separate and very siloed. And the beautiful thing about this collaboration is kind of bringing those two together. So it really brought a unique perspective to what we normally work on, as I'm sure likewise for the Healthcare Association, having some other folks that bring a different perspective and angle to the services that they provide for those individuals. So it was really, I think, because of that unique partnership, it really stood out to folks, and it garnered a lot of attention in Nebraska, a lot of great bipartisan support, and was really, when you're dealing with tough issues like dealing with the COVID pandemic and all of the other things that came as a result, it was kind of a feel-good moment for everyone that they really needed. And so that was really successful in our efforts in getting this grant program implemented.
Awesome. Anything to add to that, Cindy? Oh, you're on mute, Cindy.
I would echo what Mitch said. It was turned out to be really a great partnership and kind of a learning experience to learn from the different perspectives, what might be the challenges, what were things that we could work on together. And it allowed us each to reach out to our own constituency and try to bring everybody together. Like I said, everybody thought it was a great idea. It was just trying to get it implemented. That was the challenge.
Great. Well, my next question is on challenges. I know this is never all roses, right? There's challenges. So, my question, Cindy or Mitch, whoever wants to start, what challenges did you face in advocacy? Did you receive any pushback? And if so, how did you respond?
I can take the lead on that one, and perhaps Cindy can build a little bit on my commentary here. We didn't see a ton of pushback from the policy. Like we've mentioned, everyone really loved the concept, including policymakers and advocates and the general public. I think as with most of these programs, you do run into some resistance when it comes to the funding aspect. That's always a question that policymakers have, is how much will it cost the state and where's that funding going to come from? So that's something that we had to work through in implementing the program, which is why it was built using there's a specialized fund in Nebraska called the Medicaid Excess Profit Fund that deals with managed care organizations. And I won't get into all the wonky details on that, but we were able to secure funding from a specialized fund. So that helped us get past the resistance that we saw with that. And then the other, resistance that we often get with issues like these is just trying to figure out how we implement the program and working with our state agency partners. They have a very different perspective than we do. There's things on the back end that they have to deal with that we don't always necessarily see. So it's just working with them to try and find out how we can now put this realistically into implementation.
Thank you. And I'll just mention our brief that I mentioned at the beginning does talk a little bit about the funding because funding is always a challenge. And I think it's a really creative place to get dollars for a program. So appreciate that. Cindy, anything to add? And Tammy, feel free to jump in if you do as well.
So I'll just mention and then Tammy jump in, but there was some education for the legislators that went along with this. At one point, we didn't realize there was a misunderstanding, and some of the centers thought that we were using the residents in the nursing home to take care of the children. So we found that amusing, but we're able to clarify that. And um, when it came to the implementation, we did have language in the statute as well that required the department, in Nebraska, it's the Department of Health and Human Services, to work with the Nursing Home Association, our association, to identify if there are barriers existing in regulations, in licensure, anything that might get in the way that we could address to make it easier to implement this. Again, everybody agreed a great idea. The challenge there was a lot of the regulations on both sides were federal. So it was really difficult. We did look at and spend some time talking about can there be one license that covers both rather than requiring two independent licenses? And that pathway became a little bit difficult in the short time period we had, so we didn't go down that route, but that conversation was really helpful. So I think that was a positive that came out of that.
Well, Cindy, you're making me think we could have a part two of this conversation on what were those regulatory barriers and what needs to happen at the state and federal level. We so often in advocacy, when we talk to the federal advocates, they say, well, that's actually a state issue. And then when you talk to the state legislators, they say, well, that's actually a federal issue. So sorting that out, right, is so often the challenge. I really appreciate you raising that. It's not just the money, it's all those details and the regulations. So
And I think it's important, when I don't remember if it was Mitch or Cindy that reached out when in Nebraska in our legislature, they have hearings. And so, I was one of the individuals in the very beginning that went and I testified at the committee, telling them about, all the wonderful things that both the elders and the children benefit from these types of programs. And so, no matter what state or wherever you're at, if you're thinking about doing something like this, be sure that you get people there who really have an understanding of those benefits and make it very personal so that people can hear from the people that are doing these programs what benefits those are.
thank you, Tammy. I was thinking so often when we do this, we really do love to hear from people directly benefiting from programs. This is a policy kind of wonky discussion, so we didn't do that today, but it is so important. And I really appreciate you raising that, Tammy. Thank you. Um, so, Mitch, just to follow up, you alluded to this in the beginning. We understand there's a follow-up bill. So one bill passed, but there's some sort of tweaks, and there's a follow-up bill that's making some adjustments to the legislation. Can you just tell us a bit about that change? And then where does this follow-on legislation stand today?
Yes, certainly. Thank you for asking that question, Jaya. So as the program was implemented, excuse me, last year, there was $300,000 set aside. So these are $100,000 grants, typically up to. And so one was awarded in 24, but some of the issues we were running into was with implementation of the program. There were a series of requests for applying to the grants that were published, but we were finding that there weren't anyone else who was able to apply to it. And some of that were some or not regulatory, but some administrative decisions that were made about who could apply to that program. So even though in the initial legislation, it did specifically reference both for-profits and nonprofit facilities to apply, for-profits were restricted from that, even despite the fact that they often serve a large portion of Medicaid residents. And so we knew that we needed to address this with legislation this year. So we introduced legislation to allow for-profits to apply and then also to expand from just the startup eligible use of the grant program to expansion of programs. So like Tammy's program, who would be able to serve more children and provide more of these enriching experiences for individuals and elder care and for children. And so those are the two main changes. So part of the idea is to allow the spend down of these funds. There's also some questions around the sustainability of this particular fund. And again, I won't get into all the wonky details on this fund, but we do want to use the dollars that were appropriated and that were intended to serve more communities in Nebraska. And so that's what it intends to do.
This speaks to passing the legislation as not the end of the game, right? Those implementation pieces are so complex, right? Cindy, anything to add to, the new legislation that's going to make some adjustments, why it's important to your folks?
Um, well, exactly what Mitch said and Tammy alluded to. The existing programs that we do have are often at capacity and there's a waiting list. So if there's a need and this can meet it, that's great. The one-time funding that we accessed was just really a benefit. The implementation at the department, we had worked with them to try to make that as simple as possible for um, nursing homes and assisted living facilities to apply. But it turned out that they kind of funneled it to a childcare area and who already had a process for awarding some federal childcare funds. So they applied the same conditions to it. So looking back, and just if we had it to do again, we would have worked with the state agency in advance to maybe smooth out that process. There was also a delay. It involved really pushing the department to get it out there. So I think if we'd worked with them in advance to it passing, it might have been helpful.
That's really helpful. Great. I'm going to turn it back to you, Tammy, and I think you spoke some to this, but just to see if there's anything to add. In the audience, there's people running programs like yours in other states, so you are in good company. Can you just say what strategies you find are most effective for making the case for your program to funders and policymakers?
Well, I think one of the most important things, if you are looking at that, get those people that are going to make those decisions into your building. Let them come and look and see what you are doing. I think it's important. Like Cindy alluded to earlier, when you had people originally thinking, oh, are you going to have these old people taking care of these children? No, that's not it. But if they can see the interactions, um, it's very easy to sell it to your legislators when they can see what's going on. I have, the pandemic was really hard on us. I mean, I'll admit that, but this is just a brief story where I had a family of three children. Two of them had children in the center that went through, everything was normal with the intergenerational. They had great interactions, but their son happened to be in our child care center during the pandemic. And I had a conversation with him, and he says, we are so disappointed that our son did not get the benefits that our girls did. Um, because it is really a beautiful thing when you see the relationships that these older people have with these kids, and the benefit for the kids too. I mean, what we see is that the kids that go through our program, they are not afraid of older people. They're not afraid of people with disabilities. Their social skills are so much more advanced by the time they get to kindergarten and school because they have had these interactions with these adults. Um, it's just really a beautiful thing for everybody that's involved with it.
Wonderful. Thank you for painting that picture, Tammy. Especially to see one family have both experiences and
Yeah,
how
I mean, they
transformational
were
it
just
is.
like they felt so devastated that their son did not have the opportunities that their daughters had.
Mhm, mhm.
Because during the pandemic, unfortunately, a lot of intergenerational stuff really got put on hold.
Yeah,
So
yeah. Thank you. Okay, well, just a couple more questions. Cindy and Mitch, I think Cindy, you made an allusion to one thing you might have done differently. That's my question. Looking back at your advocacy, is there anything, any lessons learned or anything that you would have done differently that could maybe be helpful to others looking to do work like this?
So I guess I would just that jumped out to me of working with the implementing agency in advance just to make sure that it's smooth sailing once the funding got approved. Um, I think we might have asked for more money. I don't know. Um, and then, of course, what Tammy alluded to and Mitch as well, of opening it up to any nursing home assisted living provider and not limiting it to just startup costs because there's also a need to expand. Nebraska has a lot of rural areas, a lot of small rural communities that really have that need for childcare in addition to the nursing home itself. So, I mean, it's just really a benefit around the board. I had my college roommate actually lived in a small town that had an intergenerational care facility, and um, we were just out of college, and she told me her kids. I said, "Where are your kids going to childcare?" And she said, "At the nursing home." And I said, "You're putting your children in the nursing home?" And she said, "No, Cindy, it's great. It's great." And her children, like Tammy said, had great experience. When they were in school, they worked at the nursing home and they loved it. I mean, it's just got so many benefits that you wouldn't even anticipate.
So when we talk about uh, addressing workforce challenges, right? It's the childcare on site, but you're actually perhaps growing the next generation of people that may be interested in a career because of their experiences as children. Yeah,
And that is really true. We, like I said, we've been doing this for 20, almost 25 years. We have children who have been through our center that now work for us.
wow, that's really powerful. Thank you. Mitch, anything in terms of what you would have done differently?
Yeah, kind of building on some of Cindy's comments, when we're going to a legislature that is very fiscally conservative, Nebraska takes pride in being one of the few states that does not leverage debt, cannot actually, per our Constitution. We're always very conservative then in our ask of the legislature when we are asking for funding for various programs. So I think looking back, that could have been something maybe you don't want to come in with too high of a number, but being a little more, visionary and ambitious about that, that's something perhaps we could have done. And then secondly, in educating policymakers in particular, there's things that we take for granted, like the fact that we know in our childcare space that, well, clearly residents in a home cannot do direct care or supervision of children per childcare regulations. That's something we kind of take for granted. I think just being clear in educating folks and just starting at the very basic level. This is how it works, just to prevent any confusion. That helps make policy like this a lot more smooth sailing. And then finally, to just kind of would reiterate what Cindy said about, the implementation. That's always something that you think everything is clear and that you're going to be good to go once it's passed, and then you find out, the agency might have a different interpretation, and so maybe doing some more of that work with the state agencies beforehand to make sure that all ducks are in a row.
That's helpful. Yeah, I think I heard both of you say sometimes I think when we're so deep in this space, some of the basics we take for granted, and to go back and say, here's what this program, here's the base, this is what the program is, here's what it does, right? Because we're so in the weeds and you know all the details. So yeah, I really appreciate that. And also, I think the other lesson here for advocacy is you passed a bill. It turns out it wasn't perfect, or the implementation of it wasn't perfect, but you are going back to make those changes. And there was still support behind it. There's a commitment and interest in making this work. So that wasn't like, well, we're done. There's multi-process. This is multi-years in the making and in the implementation process. So that's a reality. Thank you. Well, one last question. Just in closing, we have webinar attendees here who may be considering similar partnerships, either run programs, but in advocacy. That's the focus of this legislation or this webinar. So, what advice do you offer them to get started in this kind of partnership advocacy?
I can take the lead on that one. My first piece of advice would be to don't give up. Oftentimes, when you're implementing new programs in your states or at the federal level, it many times takes multiple efforts and many years in order to get something across the finish line. And so just being persistent about it and to never give up at every stage of the process, even now with the bill that we have this year, there certainly have been moments where you're not quite so sure it's going to advance. But just being persistent and working with your policymakers or as advocates, working with folks who work in the policy realm to help move the ball and to keep that little bit of optimism, realistic optimism, in order to advance it.
Great. Cindy?
So I would just re-emphasize finding that champion. Not every state may have a Senator Anna Wishart, but she was sure passionate about it. She had a close relationship with her grandparents, wanted to make sure that others had that same experience. She visited nursing homes in her district. She's an equestrian, so during the pandemic, she brought her colleagues over and they went around to the windows of the nursing homes and visited with the residents while they were on their horses. Just things like that. So that was a big bonus that, may be hard to find, but if you can find a champion, it sure helps. And then I would say having those stories ready because data is helpful when you're trying to get something passed, but you also need that story to make it human, like Tammy provides. That's what moves people to say, out of all the things we're being asked to fund, we want to fund this one. So I think that's helpful. Those are the two things I'd add.
Thank you, Cindy. And Tammy, you've actually testified at hearings to share the realities of your program and your experience. Anything to add?
No, I think we kind of talked about most of that. Just find somebody, like Cindy said, it's those heartfelt stories that really move people. So, if you have somebody in your state or your area that is doing the intergenerational, bring them in, allow them to testify. If you're able to invite them, senators or congressmen, whoever you have in your state, that show them what you're doing. That's very powerful to show them what you're doing.
Thank you. Well, your remarks, your partnership has been powerful. We really appreciate your sharing your experience with us today. Thank you to our panelists. I am going to turn the program over next to Ilanka Walker, who is our intergenerational specialist here at Generations United, and she is going to take us through our final segment. Ilanka.
Thank you, Jaya, and to our panelists from Nebraska for sharing their advocacy journey to encourage innovation and promote a range of intergenerational shared sites through a grants incentive program. Now we're going to shift gears a little bit to another advocacy strategy, securing public funds to expand a specific successful model. The model we're featuring is Bridge Meadows in Oregon. We will start with sharing a brief video about the program.
Bridge Meadows.
I believe in Bridge Meadows.
I believe in Bridge Meadows.
I believe in Bridge Meadows.
We believe in Bridge Meadows.
That was such a great video. I love to see all the intergenerational connections displayed. And I am so delighted to have with us here today Dorinda Schubert, the Executive Director of Bridge Meadows in Oregon. I just have a few questions for you here today, Dorinda. And the first one is, the video just gave us a quick snapshot of younger and older people living at Bridge Meadows. Can you describe your program and how it promotes intergenerational connections?
Sure thing, Yolanda, and thank you so much for having me here today to share our story about Bridge Meadows. So at Bridge Meadows, we create and inspire intergenerational communities and enriching the lives of children, families, and elders. And we have 3 communities in the state of Oregon, and we're expanding to Washington State in about 2 months. And so what happens at Bridge Meadows is we create these beautiful, you can see behind me, neighborhoods that are filled with children who have been impacted by foster care and their caregivers. And that could be kin, it could be grandma, it could be auntie, it could be a sibling, and it could be people who just want to use the foster care system as their adoption agency. We also have families who've been reunited after foster care, living in our communities. Then there are elders who are 55 and older of limited means who live in our communities. So our communities are about, on average, 40 units of housing, and everybody pays rent. And the families' homes are big enough to include a whole sibling group of kids, about an average of 3 kids per unit.
Wow, that's amazing. That's very extensive. Your program has also received tremendous support from leaders in your state. What has been the key for Bridge Meadows to make the case for state and local government support, especially when many state and local budgets are strained right now?
Well, my colleagues from Nebraska said many of the things that I'm going to share, but it begins with relationship building. We believe that relationships are the healing agent, and the community is a healing agent inside Bridge Meadows communities. Well, the greater village that supports Bridge Meadows requires the same exact thing. So it's a lot of time spending time with people who make those important decisions. I think Tammy said inviting them out to see what you do. We also have therapeutic services on site to help knit the community members together, because you just can't expect 3 generations to come together, live in a sweet, beautiful neighborhood, and like, bam, they're friends. You need some help pulling that together, right? And also, some of our folks who live in our communities have experienced trauma. So we need to make sure we have those therapeutic services. And so when people visit and they see the health and well-being that has stabilized for children and families, then they can go, oh, I get it. When they see that the affordable housing dollars are being spent in this beautiful way, as you can see behind me, oh, I get it. And what's most importantly is when they see themselves in the solution. We often hear, oh, I wish I would have had this when I was raising my kids, or I wish my mom could live here. And that, I think, is when you hit their heart. And then now they're going to be able to hear all your stats, all your statistics, all your facts, all your return on investment language. And I think that's also important too, to have clear messaging, to explain how using one antidote, as I call it, an intergenerational solution to solve big problems can happen. And so we make the conversation about this is an economic solution. This helps people stay in the workforce because these parents have support of their neighbors and they can stay in the workforce. So caregivers are supported that way. This is an economic solution for the healthcare system because our dear elders are living till their last day on earth inside our communities, or they are living as long as they can in a community setting before they need higher level of care, which is so important to have in our communities, right? So we're also watching them, as somebody said, that elders and kids are not afraid of each other, or not, we're reducing ageism. And so these youth are more likely to take a job in a place where there are people different ages of them. So you just make the case about how this helps the economy, the workforce, as well as the health and well-being of your neighborhoods. And then also it took proof of concept. Like we are going on our fourth Bridge Meadows in a 19-year history. And we've been very blessed to do evaluation with Child Trends. And we've also been very, very blessed with all the national media that we've received. And nothing makes our legislators and our civic leaders more proud than to speak about the thing that gets lots of national attention, right? And so they want to be with winners. So that's the other thing. So relationships, clear messaging, come visit, and proof of concept.
Thank you, Dorinda. Those are great nuggets to have. So you have been successful in securing government funding at all three levels, the federal, state, and local. Did you ever hit any roadblocks on your journey, which I'm sure, and what did you learn from them? Do you have any tips for the audience of turning that challenge into an opportunity?
Sure thing, Yolanda. Yes, of course, there's been roadblocks in time. I often joke that things happen on Bridge Meadows time, not on Dorinda Schubert's time. And so I have to be very patient, which is not a skill set I have. But I think one of the first roadblocks was confusion. Like what? I think I heard somebody, I think Cindy said it. People are so confused. Like, what are you doing? Wait, the elders are parenting the children? Like, no, there are three generations. Well, who's the third generation? The parents. So you have, even though there are so many cultures around the world that this intergenerational living is part of the DNA, it's fascinating how it's confusing to folks. But then our systems are siloed, right? Housing's over here, child welfare is over here, elder stuff is over here, health and well-being is over here. And so we in the intergenerational space, we got to know all these people. And thank goodness I like to make a lot of friends, but it can be exhausting. And so sometimes it's about, do you have enough time to be doing it? So I'll say that can sometimes be a roadblock. And then when change in leadership happens, oh heavens, you have to go now educate the new person that they finally got it. They're your champion, and they're like, I'm retiring now. I'm like, or I'm going to, a different job. Oh, please. Okay. So that's been some of the roadblocks, but they can also be opportunities, because then you're going to find a champion in there, and you're going to want that champion to carry things. But I will also share, this happened recently. Let me share a story that happened recently. We are asking the state of Oregon for some capital funds to build our one of the next ones in the pipeline. And one of our representatives said, okay, well, I'll put the request in for you. And when he did, he was told he had too many requests and he couldn't put it in. And so now he feels so bad that he is motivated that the next legislative season, we are at the top of his request list. And so, I just took that opportunity. He feels really bad, and I'm like, well, I will be talking to you monthly about how we're your first top priority in January of 2027 so that we can get that funding. So that was an opportunity to also, just take that relationship and maybe, January is a better time than right now for this particular project. So that's something that we've done. Also, we've also taken just to maybe that wasn't the right time for us to do that project, or a priority for a state or the city that matched us better came later than when we were really trying to, make our case. And then we were top of mind for when the priority changed. Like in maybe senior housing is more of a priority in a future play time than it was when we were asking. So we've seen that too.
Yeah, thank you. That's so important, like being able to pivot, handle different challenges, and find which time is the best to make certain priorities and make different changes as you go. And
And the
one
key
final
though,
question.
I'm so
Oh,
sorry, Elika, the key though was never losing communication with the people that you have engaged, which can be really, really hard, as we're also all trying to, pay for payroll and, take good care of what you already have created. So I don't want to minimize that this is this can be a big challenge, but it can have great dividends in the end.
Thank you. One last question. Do you have any advice for other intergenerational programs about how to get started securing government funding for their programs?
Yeah, the very most important thing is go find a champion or three. I think my colleagues from Nebraska said that earlier. I cannot emphasize that enough. If there's something you all walk away with today, is go find a champion. Go find somebody who, love their grandparents, whose children spend lots of time with older adults, who themselves had this life experience and understood why it was so meaningful, or wish they had had this life experience. Go find those people, make them your friend, bring them to your community. And if you're in the dreaming stage and you're in the visioning stage, pretty pictures do a great thing. This behind me, what you see, was started with a very pretty picture, and we jokingly call it, and we have framed the pretty picture, because that was the pretty picture, the telling the story of what this could be, was what got us the funding that eventually now we're on to number 4. So don't minimize the pretty picture and telling the story if you're in, the beginning stages of what you're doing. And if you are in the middle stages, a story after story after story, and sharing time. But in every Bridge Meadows community that we have created, it was because a champion got that spark. So I can't emphasize that enough. And then be clear about your messaging, and you'll have your statistics, but also those beautiful stories to make it real. That is so important. And then tie your idea to the priorities. Be knowledgeable about what are the priorities of the city, what are the priorities of the county, and the state legislature. And it could be, what's the priority inside housing? What's the priority inside seniors? Go look and find out how you can match that. That has been golden for us. And until there is a Department of Intergenerational Solutions across America, this is what we have to do, is we have to go look in these different buckets or silos, if you will. And then last, Mitch said it great, don't ever give up. Do not give up. I know there are times when you just are like, this isn't working, I can't do this. And I'll just share what I do for myself when that happens, is I just imagine the sound of the children and the elders, and the relief on the faces of the parents. And I'll just think, okay, well, no matter how hard my day is right now, it's worth making sure that these children and parents and elders have a beautiful place to live, because the impact is so great. And it's not just for the generation that we're working with, or the people who live there right that minute. It's for future generations to go on, because intergenerational solutions have this beautiful ripple effect across generations. It's just not helping or working with the people right there in front of us. So don't give up, team.
Thank you. What a perfect way to end. Thank you to Dorinda and our panelists, Tammy, Mitch, and Cindy, for sharing their wonderful wisdom with us today. As a reminder, you will receive the recording and slides in your email soon. We also invite you to complete the webinar evaluation, which you will receive in a follow-up email. Please share our new resource and sign up for e-alerts to connect with us on social media. And as we close, I would like to leave you with a quote that illustrates the power of connection for one of my favorite intergenerational advocates, Mr. Rogers. Whether we are a preschooler or a young teen, a graduating college senior, or a retired person, we human beings all want to know we are acceptable, that our being is alive somehow makes a difference in the lives of others. As you go today, know that your work and your advocacy make that difference. Thank you, and thank you to all of our panelists and my coworkers at Generation United. Have a great rest of your day.
Thank you, Ilanka.